Hi, I'm Dr. Dory Carlson, the president of the American Optometric Association.
And I'm Dr. Ron Hopping, president-elect of the American Optometric Association.
We're here in DC at the largest optometric advocacy conference in history. And I'd like to take a minute to talk to you about AOA's #1 priority, patient access to optometric care. Nearly 700 optometrists and student optometrists from across the country are on Capitol Hill right now taking our patient access message to the offices of every U.S. Senator and Congressman. Yesterday, we met with federal officials overseeing the new health care law to urge AOA-backed provisions like the Harkin Amendment, the Stabenow Amendment, and the Pediatric Vision Care Essential Benefit that they be implemented exactly as Congress had intended.
AOA members from all over the country have met together to get updates on challenges and opportunities at both your state and federal levels in legislation and on the regulations affecting each of us, as well as on third-party and insurance updates. Quite a bit of information was exchanged on these issues, ranging from scope of practice laws, on real threats from outside our profession, and on strategies to deal with these threats. We also looked at the opportunities that exist in this new era of health care delivery. We also heard from and interacted with some of the most important developers of health care policy in the country. They now better understand optometry and the unique role we play in primary health care.
You know, I don't know about you, but I was in the legislature in the years when we worked like the devil to just put in eye drops to dilate people's eyes and things like this. We didn't have any of that power. I went through those battles as a legislator, working my guts out to expand the scope because I understood that if we hung our hat on being glorified refractionists, we were dead in the water. And we have an opportunity right now with the kind of battles that have been fought at the state level, and believe me, all the way through therapeutics. I got my nose bloodied more than once in those battles. But it was the right thing to do, and it was the right thing from the standpoint of optometry and where optometry needed to position itself, and tying ourselves to a VSP and a standalone vision program is going to hinder our ability as a profession to move in to the full scope of optometry. We'll fight those battles on scope of practice with physicians, assistants, and others.
Dr. Carlson also gave an update on AOA's stand on patient access to optometry and where we are with standalone vision plans.
Earlier today in his remarks, Dr. Kreidler referred to vision service plans. So with all of you here, I thought this would be a good time to speak to you a little bit. In that vein, I wanted to report to you that, as many of you have asked, we've had several conversations over the past month with VSP. We've had those conversations to seek a way forward which would marshal our joint resources in the interest of patient access to optometrists. While no consensus has yet been found, and trust me, these discussions have been very difficult, rest assured there is no need to be fearful of patient access concerns. The AOA is committed to ensuring that no disruptions in access occur during the implementation of healthcare reform. We are completely committed to strengthening the integration of vision and medical care, allowing for the continuity of care our patients deserve. It is our belief that we must embrace the opportunities in the rapidly changing healthcare landscape to ensure patient access to all aspects of optometric care, not just part of the care we provide, and most importantly, at parity with medicine for many more years to come. Thank you.
This is important work. It is important to optometrists. It is important to the patients we serve. This week, we have seen the real benefits from our excellent staff and the self-sacrificing efforts of our volunteer members working together as a team. That working together is how we always have, and the only way we will accomplish great things for our profession.